So we've taken Eric's films and they're standing full spine x-rays in order to really see what's going on in his spine with gravity. So if I laid him down and took these pictures, the biomechanics would not show any of this. So we do it standing. So to give you kind of the gist of what we're seeing here is Eric is standing with his mouth open so we can see everything from the base of his skull to where his legs meet his pelvis. So if we start at the bottom, we can see that his right leg, this is the right side, this is the left side, we'll turn the x-ray around so we can view it in the same way that we do our analysis and the same way that we do our treatment. It's from behind. So it's the only film that we do that with. So to start with, Eric has a short leg of 7 millimeters. It's a deficiency of 7 millimeters. Now none of these things alone mean anything, but when we put the whole thing together, it may have some significance. So we keep all that in mind. So his pelvis is slightly torqued. His sacrum, as we measured it, is also rotated a bit. As we start looking up the spine, it leans to the right, and as we can see back here, there's kind of like a change in this spot in here, which correlated to where we saw in his spine. So we're going to be very interested in this area, and as we come to the top, we can see subtly that things are torqued to the right. Now, you may not be able to see these on film, but I want you to get kind of a gist of how we begin to study these. When we look at this side view, now we can see every contiguous vertebra. We drop a plumb line down to the center, and we can see that he's standing back off of center, which immediately causes stress in here, here, and here. Now, when we did our examination, we found that this area down here was very tender. We can examine that disc space that's very small in the back here, not giving it a lot of cushioning, and it's even lost some in the front. So we have some disc loss in here, and the bone has actually been pushed back against the one below, which is the sacrum, by about 5 millimeters. So the nerve that comes out of here doesn't have a lot of wiggle room. So it can be easily irritated when sitting or moving or lifting. So we're going to keep an eye on that. Standing back and doing a global look, we'd like to see 3 curves. The neck, the cervical spine is called the lordosis. This part here is called the kyphosis. You want it to curve back, and another lordosis in here. When we're born, we have one big curve. When we're able to hold our heads up, we curve back this way. When we're able to walk, this curves back this way. Now, I'm suspecting that Eric had a fall at one time because we can detect some dents in these areas here where the discs might have dented the vertebra. Does that sound familiar to you as a youngster? And his tailbone has been displaced a bit. So this probably was caused as at a young age. And as he gets older and bigger, things don't go away. They actually compensate for these problems. Another interesting thing, instead of there being a curve in here, it's very, very straight. It's another thing we take on looking at what we call biomechanics. What could be normal? What could be interfering with the normal function of the spine? And in his neck is very significant, is very, very straight in here when it should be curved. And not having a curve in here makes it harder to hold your head up. See, if you have a curve in your spine and you're holding a weight like this, you could do it easily. But try holding a weight in your hand like this. You'll find a lot of stress back here. So I would say working on computers for a while after you're kind of doing like this in your neck after lifting and things like that. So a lot of the things Eric told us in his first part of examination in his history was there was discomfort here, 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 and here. So the more evidence we get into the correlation, the more specific we can get to setting up his treatment plan. So right now, I wrote down specific positions of the vertebra that we found, and it's kind of in a code called a listing, and that's where we begin to correct these with a specific adjustment, which we'll show you in a moment.